Celiac disease. Celiac disease is an immune-mediated disease that is characterized by ingesting gluten products such as wheat, barley, and rye. It is classified as immune-mediated because it stimulates an immune response which creates the production of antibodies and cytokines. Risk factors of celiac disease include type 1 diabetes, Down syndrome or Turner syndrome, Addison's disease, rheumatoid arthritis, a family history, or genetics. More specifically, celiac disease is associated with the genes HLA-DQ2 and HLA-DQ8, which are located on chromosome 6p21.
This is a normal picture of the villi. As you can see, going up it is blood vessels and lymph vessels. These lymph vessels absorb things such as fats, and the blood vessels absorb things such as carbohydrates, proteins, and nucleic acids. When people have celiac disease and there's inflammation of the villi, this nutrient absorption can no longer take place.
In normal physiology, trypsin, chymotrypsin, and carboxypeptidase are produced in the pancreas and enter the duodenum, which is the first part of the small intestine, through a duct called the major duodenal papilla, where they plant themselves on and surrounding the brush border, which is also called the microvilli. When you ingest gluten products, glutenin and gliadin are presented in the brush border, where they are met with these enzymes. The trypsin and chymotrypsin break the proteins down into polypeptides. The carboxypeptidase and aminopeptidase continue to break these polypeptides down into individual amino acids. These amino acids are co-transported across the apical membrane of the absorptive epithelium cell using active transport. The amino acid then exits the basolateral membrane using facilitated diffusion and enters the capillaries.
When the gluten protein, gliadin, passes through the epithelial cell, it enters the layers of the small intestine and binds to a HLA-DQ8 or HLA-DQ2 protein, which is only present in those with celiac disease. This protein is embedded on an antigen-presenting cell's membrane, such as a B cell or dendritic cell. When the protein binds, it attracts helper T cells, which make pro-inflammatory cytokines. When it creates these cytokines, cytotoxic T cells and B cells start to arrive and become activated. As more pro-inflammatory cytokines are accumulated, this causes inflammation of the villi, which ultimately leads to the temporary change of the villi, which prevents nutrient absorption. As you can see, the healthy villi are longer, where the damaged villi are flattened due to inflammation in the lumen of the small intestine. Some symptoms of celiac include, for infants, failure to thrive, diarrhea, and abdominal distension. For older children, anemia, constitutional short stature, dental enamel defects, and constipation. And for adults, malabsorption, diarrhea, constipation, bloating, flatus, belching, weight loss, and abdominal cramping. And we'd like to focus on a few of these, such as failure to thrive, malabsorption, and abdominal cramping. These are all caused by the inflammation of the villi and the inability to absorb nutrients.
Diagnosis. People experiencing these symptoms after ingesting gluten products or people who are exposed to the risk factors should refer to their doctor, whom in turn will have a blood test done that screens for certain antibodies, which will be abnormally high in people presenting with celiac disease. These antibodies are produced by the immune system because it views gluten as a threat. It's also a good idea to get a blood test done to screen for celiac disease if an immediate family member of yours is affected by the disease.
Currently, the only treatment for celiac disease is following a gluten-free diet.
The first key concept we will take a look at is the cell membrane. The HLA-DQ2 or HLA-DQ8 protein is embedded in an antigen-presenting cell's membrane. The second key concept is homeostasis. The villi in the small intestine are damaged by inflammation, which prevents proper nutrient absorption. The third key concept is proteins. Gliadin, a protein found in wheat, reacts with the HLA-DQ2 or HLA-DQ8 proteins. Gluten is composed of gliadin and glutenin, which are both proteins.
In summary, celiac disease is an immune-mediated disease caused by the protein gluten, which activates the release of pro-inflammatory cytokines, which causes inflammation of the villi in the small intestine, inhibiting the absorption of nutrients, which results in the symptoms of celiac disease.